Back with another episode. Our next guest started in healthcare thinking it was just going to be for some time. But 40 years later, he's building systems that serve the people most of the country forgets, which is not a job, it's truly a calling. Kirk, what's up, man? How are you on this beautiful Friday?
I am great. I'm great. Glad to be on the program with you today.
Yeah, man, same here. I know it's been some time since we've had our last conversations, but I want to get right into it, man. You're on track to become a CRNA, and then what most, what was most that you really decided, I don't want to do that. I want to do executive leadership. Why was you feeling that was your lane?
well, look, it really started out with the fact that, as I shared with you in the past, I had a neighbor that was a CRNA, and I thought that'd be a cool job. You go to work early in the morning, you're all in the afternoons, live in a nice house. Well, I started school, and I got about halfway through, and I realized, oh my God, I could not be stationary, be sitting in one spot. I got to move too much. And so I continued on my track on a professional route, and in a clinical professional route, I should say. And from there, it kind of turned. Opportunities afforded themselves. I really never thought I'd be in this position today. Never ever. I thought, well, I'm doing always, always felt like I've worked my last job as hard as my first. And, I had great mentors, great leaders, and then one led to the next. And that's, I'm here today.
As I'm looking to you, I'm a little jealous. Normally, I'm at home on a stand-up desk. Today, I'm in Boston in a hotel room, and I can't stand up with you. But it looks like you have all the energy, so I'm super excited.
Yeah.
And something about traveling, man, that I love about you is that you've been able to do this in multiple countries,
Yeah,
right? You've been able
absolutely.
to go to multiple hospitals. What does that look like for you, man?
Well, I went through a period of time. I was running a health system in Louisiana, Texas, and Arkansas, and actually I was asked to go in and help do a turnaround. It was in bankruptcy. I merged them out of bankruptcy and really got stood up all those facilities again, and then we sold them off. And I really got to the point where I want to do something different. So started my own company, Global Health, and next thing we know, we're in 21 countries throughout the Middle East, Asia, India, and design, build hospitals. And then, as you and I were talking earlier, that pull away from family was tough. You're on the road, out of the country, 8 to 9 months a year. That's tough. And so sold the company and really just was looking to slow down a little bit. And next thing I know, I get a phone call and say, hey, we got this opportunity. You want to take a look at it? And I ended up here. That's 13 years ago.
Where does this entrepreneurship come from, man? Building something so large like that doesn't just come overnight.
Well, I think it's from really the work ethic I got from my mom and my dad. And my dad was a businessman, and you know, uh, I don't know. I just think that we were all built. My siblings and I are all built with this drive, and I really think it's a testament to our parents.
Love that. And now you're in a space that you mentioned a little bit more, a little easier for you. What is the hospital? What is your role for those that are watching and may not know?
Well, I'm chief executive officer for the largest rural hospital in Louisiana. When I arrived here, April the 1st of 2013, we were in the beginning of the last quarter of our fiscal year. So we're on what we call a fiscal year. Our year ends June 30. So we finished that year with about 57,000 patient encounters, meaning they came to the ER, they had surgery, maybe they had an admission, went to one of our clinics. They were in that number. This past year, June 30, we finished with a little over 225,000 encounters. In about 11 and a half years, we've grown, and we're continuing to scale up. It's just a phenomena. That was the reason why I came here. When I really looked at the opportunity, I realized, oh my goodness, this place was successful in spite of itself. And what if we just put some things together and really grow it? And so we've been on a track, and I've been really fortunate. I work for a great company, allow me to do a lot of things. I've got an amazing board of commissioners, so it's been good. We have the hospital, we have a senior living center, we have 12 clinics. We have two rural health clinics, a cancer center we acquired 4 years ago. Really, we call that a capstone program for us because it's allowed us to really keep our community members here. It's been a good journey. It's been a good journey. We're not over yet. We're not over yet.
Oh no, no, like you're just getting started, man. Like you're just getting started all over again. But one of the things you mentioned to me was that you guys are, obviously hospital, but you like to say that we're service providers. What does that shift in mindset actually do for the culture and for the outcomes?
Well, at the end of the day, that's what we're here to do. We're here to serve this community. We're a public entity. We do not have a millage to operate, so we're what we call a self-sustaining organization. We've got to be able to, run ourselves and continue to grow and build our workforce. I arrived here, we had about 450 associates. Today we're a little over 1,100, and continuing to grow and add services. And everything we do is always forward-facing about care for this community. That's kind of our core purpose.
And you said there's no such thing as no. When last time I spoke to you,
There-
what is that about, man?
There's never no. You can always figure out a way around. I don't think I've ever, look, I don't do well, I don't do well in a box. So I like to be able to get out and be entrepreneurial, and it's been really good. One thing I've really focused with my team and our managers is you have an obligation outside of the four walls of the organization. You really got to be out there and really be a member of the community. So our leaders really, their job is 24/7. Most people embrace that, and if you can't, that's okay. But we really need folks to always be representing healthcare for this community. And we innovate. We think of ideas and ways. What can we do differently? I'll give you an example. We're one of the poorest municipalities are parishes, and we have parishes here. We don't have counties. We're one of the poorest in the state. I think probably the poverty level is, our median income within the city limits is under 17,000. So that just gives you an idea of the poverty here. And even within the city limits, we had a high no-show rate at our clinics, as high as 30% in certain clinics. And we had to figure out, what do we do to make sure we get our community members here. So we just put together a logistics department. We opened it, and so we transport patients. We're now transporting about 1,400 patients around the community just to get back and forth to clinics. Now we don't take them grocery shopping, and we don't take them to the stores, but it's really about healthcare. What can we do to innovate and make a difference? I'll give you another example. In COVID, we quickly stood up. The governor called all the hospitals, onto these conference calls. We'd have those every other day, and he says, "Look, we're starting to vaccinate the communities. We need your help. What can you do?" I picked up the phone and called the mayor, got the parish president involved, and all of our city leaders, and I said, "Look, can we commandeer the event center? We need to be able to vaccinate this community." So we actually did. We took over the event center. It's a big space, about 25,000 square foot space. We took over that space and began to vaccinate up to 1,000 people a day. Were able to run through. But we quickly realized after about a month that half of our population was not attending. And we're 50% African American here. And they weren't coming. For whatever, and we tried, we couldn't get them to come. So our chief medical officer, Dr. Mason, is an African American female. She's amazing. And I said, "Look, let's call a Zoom meeting." At the time, we were really just getting going on Zoom. That was 6 plus years ago. And so we called all the ministers together. So we got about 14 showed up for a meeting here. And then we had about 12 that were on Zoom. And we said, "Look, what can we do to get to your parishioners, to get the word out?" And we quickly realized they were very fearful themselves of the vaccination. And I attribute it to things like the Tuskegee incident issue years ago. And there's just this fear of healthcare, and that kind and like. So by the time we finished that meeting, after about 90 minutes, I was on a Friday. We then stood up a town hall the following Wednesday. We did it at the MLK Event Center here in town, and Dr. Mason really led that. We brought all the churches together, and they typically have a Wednesday evening worship service, and then she spoke directly to the community members. We did that through Zoom, and then within about 3 to 4 weeks, we saw our numbers were evened out. We're about 50-50 on our vaccinations, and that's what we call just doing things to make sure we take care of the entire community. It's a challenge. We do these podcasts with physicians every month at one of our local radio stations, and we did our podcast last month was on prostate awareness. And I was in there with one of our urologists, and we were speaking, and he gave some alarming statistics. Being being 50% African American community here, African American men have a much higher incidence of prostate cancer. So it's and we just got to get the word out. And so we quickly then stood back up what we used to call our pulpit conversations, where we go to the churches, we go in there and we talk, and we just explain things, and it really makes a difference. You just got to figure out how to get to different constituent groups. Sometimes it's in the churches, sometimes it's on the street, sometimes it's in, we call town hall meetings. It's just kind of those things. You just got to try to figure out how you take care of the community.
I love it. You're quick to pivot. You're quick to figure out what's next. How do we make this happen?
Yeah.
And as an entrepreneur, as a leader, you have to think like that. I love the what you mentioned a little earlier as you started speaking was within my four walls. I didn't want to just be within the four walls. And
Right.
I remember leaving a company after 8 years for that exact reason. Because when I wanted to do more, she told me I had to wait. She waited 25 years for her opportunity. I had to wait for mine. And I'm like, there's no way that I can stay within these four
Right.
sandwich walls, right? Because I was working at the subway at that time. There has to be more, right? There has to. I was chasing purpose and passion, not so much paychecks. And Kirk, you've been doing that so good, nowadays. And you talk about innovation, how you guys were able to innovate. Crazy that Zoom was, you said was like 5 years ago, right? Everyone's now on Zoom, and look what we're doing now virtually.
Right.
To be able to just have these conversations and educate people as well as what you mentioned it. But I want to talk about innovation in the sense of AI. I think it's a beautiful thing. So many people are using it in spaces as transcribing for doctors to be able to do less note taking and just more engaging on the level of the patients.
Yeah.
Where else do you see AI being a big factor in the space of healthcare?
Well, look, we're piloting 4 different AI softwares in our clinics with our providers. And for the point you made, it's the fact that it can, through whether it's an ambient listening device or a scribe and you're using AI, it really helps the provider by the time they're finished. Basically, they've completed their note. All they have to do is go in there. If there's any edits, they don't have to then fill in the blanks. So again, our goal was to have a integrated AI product in all of our clinic and clinical settings by the end of this calendar year, which would be December. The issue with that is the technology is changing so rapidly. I don't think we can pigeonhole ourselves into one product. And that's just on the clinical side. The other piece we're using AI now is on our billing. Our billing and claims management processing, we're pushing out in the neighborhood of, 225 to 275,000 claims are going out annually. So with that, we had to figure out a way, what can we do? What can help our billing companies and help maximize the provider's documentation so that we take advantage of what payments are. And again, we don't want to fabricate anything, but we bill in healthcare off of the severity of illness, and we determine the severity of illness based on the documentation of the provider. So the more in-depth the documentation, then the higher coding you can get, and then potentially helps you with a higher reimbursement.
Do you feel like you get some pushbacks when you were implementing some of these pilot programs on AI? I feel like so many people were kind of scared of what AI was going to do, take away jobs, but it really it's beneficial, right? It's helping us do more of the things that we love and less of the things that we don't, which is documenting, as you kind of mentioned. do you see pushback, and how are people actually taking it now? You've been piloting some programs.
Well, look, it's interesting. Our providers were the ones who were demanding it. So it really made it easier for us to be able to do that. And look, we've got a very innovative medical staff here. I think it's because of our approach. We're very forward facing. You know, for instance, we used to have, when I had an amazing chief nurse here for probably my first 5 or 6 years, and she went on to become a nurse practitioner, and she left me, but she's doing great things as a nurse practitioner. Nonetheless, she came to me frustrated. She was like, you know, our doctors have complaints, and it just never feels like we ever close the loop. I said, well, why don't we treat them like we do our patient concerns? And I started when I got here, basically 13 years ago, is stand-up meetings and immediate. So if we had a patient concern took place, we want to administer or work through a service recovery in real time while they're still here. So I would call a stand-up meeting, a 5-minute meeting. What's the issue? What's going on? If we can't address it and come to a resolution in about 5 minutes, we disband. And then before the end of the day, we would recircle back again and close that loop. So it really made a great difference with our patients and their families. So I said, Donna, why don't we just do the same thing with our physicians? Let's treat them the same way. Let's change it from our patient care committee to a customer care. And so we treat our physicians as our customers. And when we started doing that probably 7 years ago, our doctors felt like, I'm being heard. I'm getting a response, and I may not like the answer, but I'm getting follow-up and follow-through from leadership. That's totally changed our relationship with our medical staff. You know, they're all high drivers, high performers. They wouldn't be physicians if they aren't. And so everything they do is always about what's the best I can do for my patients. I want to make sure we provide the highest quality of care and the safest care we can do. So.
You're a stand-up guy, man. Stand-up meetings, stand-up desk.
I talk with my hands. If somebody tied my hands behind my back, I'd be in trouble. Okay.
Same. No, I wouldn't know how to do that, to be quite frank. It would be very hard. But the stand-up desk, man, not a lot of CEOs actually get into a space where they feel comfortable. You want to make sure you're comfortable in the position that you're doing. Yeah. But also the energy feels different, right? When you're standing up and you're having these conversations. Like, where did that come from? Is that something that you just kind of, it happened this year, that it happened over the years? Was it always a thing?
You know, it's been a few years. You didn't know me when I used to be 350 pounds.
No way, Kirk.
Oh, yeah. Yeah, I was a big boy. And so I just decided one day, I said, look, I want to be here for my kids and my grandkids. And I don't want to, I just started this health journey about, 5 or 6 years ago. Didn't take medicine, didn't have surgery. I said, I'm just going to go to the gym. I'm going to cut out carbohydrates, and I'm going to keep moving. I never felt bad. I didn't realize how big I was. And so I got everybody in my office, every single senior leader, and our executive assistants all have stand-up desks. About half of us use them every day. So I stand up probably 90% of the time. Only if I'm in my conference room in a meeting do I not stand up. You know, and I'm always about engagement, having time limits on meetings, and you don't bring a phone to a meeting. When you go to a meeting, you could leave the phone at the door, and if it's that important, they'll come get you. Yeah. Because I think it's a distraction. Same thing with laptops. I said, look, this isn't a meeting where you're answering emails and we're having a meeting. I want to be cognizant of your time as well. So those are just some of the things we do. And we have no meeting Fridays. So we have no meetings in this organization on Friday unless we have to. And maybe if they're with a physician, we'll have those kind of meetings. But I wanted our leaders to be able to wrap up your week, get everything done off your desk, all your projects and timelines completed, and so Friday's your day. And it's really made a difference. We did that probably 7 plus years ago. You know, we're what you call a Baldrige organization. We're on a pursuit of a national Baldrige Award. Mm-hmm. Everything we do is process oriented. Everything has a reason behind it. How we communicate. You know, I do quarterly CEO roundtable meetings. Those are mandatory for our associates to attend. They'll be coming up next week. I'll do 12 of those in a week. They're about 30 minutes long. from early in the morning, midday till late evening, and it's to be able to catch our folks and do face-to-face meetings with them and say, hey, what's going on, what's working well, and the like. And that's all about communication. How do we push information down through the organization, and how do we get and receive information from every single member of our team? So that's mission critical for us.
Hey, real quick, if you're enjoying the podcast, we first want to say thank you. And we also just want to give you a little insight of what we're up to at FRANSiS. Some don't even realize that we're working with organizations to help them use AI to create that real human communication experiences, whether that's actually supporting your families, those patients, or the entire community. We're actually creating tech that connects. Check it out, francis.ai.
That's some good stuff you just mentioned, man. First of all, the 350 pounds. Kudos to you, right? Stay consistent. Consistency wins all the time. People always want to know how do you get to do what you do. I always say you got to stay consistent. Just gotta do the reps and work in itself. And obviously you've seen it, but also investing into your people. Like a lot of leaders fail because they forget to invest into their people. They lose amazing talent because they're not invested into their people. And everything that you mentioned is investing.
Right.
Where's all that coming from? Like, did somebody pour that into you? Were you learning that the hard way? Were you learning that because someone wasn't doing it good enough? So you said, you know what, let me actually implement some of these things. Like, where does this all come from, man? Because leaders that are watching need to know how to invest into their people.
Well, look, we've done a couple of things. And look, I've learned from every leader I've had over the years. I've had some amazing leaders and mentors. I've got 2 or 3 that are absolutely phenomenal. And then I've had some really bad ones.
Yeah.
And you learn from both. I mean, I take it from from everybody. Look, my philosophy is you treat every single person in the organization as if they're the boss. And it doesn't matter what your role is. You might be our groundskeeper, or you might be our chief medical officer, but you still deserve the same level of respect at any level, whatever you are. So when we greet people, we have what we call check-ins with our team members every 6 months. And we call those high, solid, low conversations. They are stand-up conversations, and we start first with our high performers. Then we go to our good performers, and then our low performers we do last. And we talk about we need to move you. We're trying to move you to be a good or outstanding performer. And that's the group we coach out if they can't get there. But look, we're in a rural area. We have to figure out and innovate. What can we do to retain talent and workforce? I mean, we're in the largest landmass parish in the state of Louisiana. Our closest competitor is 35, 40 miles away. And we just have to figure out what can we do differently. So so we've been focusing very heavily over the last probably 8 years on successioning, because every one of us in healthcare in our roles will go away. And so are you going to leave that organization better than you had before? And you cannot do it unless you have a sustainable workforce that's behind you to take over. So we put in place what we call a leader index, and our expectation is every leader needs to have at least 1 to 2 people behind them that can fill in for them, take over if something will happen. And so we call that our survivability index. And I'm actually writing an article on this. We're doing a white paper. I came up with one of our leadership coaches we use. And so this is the deal. What's your survivability if the bus went off the cliff tomorrow? So if every senior leader was on this bus and the bus went off the cliff, could this organization survive? And we base that survivability index on what percentage of our leadership team has a replacement that could fill in tomorrow for them. And we did the same thing with our leadership throughout the organization. We have 65 leaders, and what would happen if they were all on a charter plane together and the plane went down? At the end of the day, we got to be here to take care of this community. And so we work very heavily and focus very hard on successioning and succession planning. The other thing we've done is we started our own leadership academy. It's a year-long program. We offer it about every 18 months. It's a rigorous selection process. We take no more than 14 into the class. And we'll reserve about 5 or 6 spots for leaders, new leaders. The rest are for potential emerging leaders. So it's an application. You have to write an application. You have to be in good standing with the organization. You have to get letters of reference, go through an interview process, and then commit to 3 years after graduation to remain with the organization.
Wow.
So we've just completed our 3rd leadership cohort group, phenomenal group. Out of that, that's our 3rd group of 14. It was from the time we began until today, we've only lost 2 of those folks. Everyone has been promoted within the organization at some point. And look, it's a rigorous training program. It's mandatory you attend all the sessions there. They're typically 2-day sessions throughout for about 9 months, and then we have a formalized graduation. And we develop as senior leaderships 2 capstone projects. The capstone projects are around areas of opportunity in the organization. The last 2, for example, were one of them. We didn't do a good job. Through our associate engagement surveys, we got feedback that says we need to do a better job recognizing and thanking them for a job well done. So one of the teams came up with, how do we do that? So now, my round tables that will take place next week, we use what we call pulse surveys. We ask people, what do you want to hear about? What questions do you have specifically for me to be able to answer to that? And then what are you looking for from a rewards and recognition perspective? And what are the big things? It's not always about the money. It's about recognizing them for doing a great job. From that, we've emerged what we call our quarterly award and recognition luncheons, where we celebrate associates and leaders that have been recognized by patients, family, physicians, or the community. It's a great process. We started that one about 3 years ago, and folks love it. They get to bring a family member in with them, and we celebrate them. And those then, throughout the year, the quarterly award recipients then go on to become an annual award winner at our annual banquet and hospital Christmas party in December. So it's a great way we recognize and celebrate
You're
people.
doing good, man. They're not gonna let you leave. You keep doing all these amazing things, man.
Well, at some point, I'm going away too. Look, I'm not slowing down anytime soon. I love what I'm doing. I wake up every morning. I've got a crazy day. I start at 4:15 in the morning. Now, I'm up out of the bed. I'm at the gym. I come back, have a little coffee. Then I go to morning mass, and then after that, I'm home 7:30. I've showered. I'm on the way to the office. So.
Put you on the spot here. What are you benching nowadays?
If I bench press 190, I can do.
You're doing good.
I can
You're
do.
doing
I can do
good.
14 is my best, and I work with a trainer because I need to be pushed.
Yeah,
So
yeah,
I got
yeah,
a
yeah.
personal trainer I work with 3 days a week, and then a couple of days I'm on my own. And I'm a gym rat. I love getting on the treadmill. I can
Wow,
get on a
okay.
treadmill for hours. But then what I do is I listen to American Top 40, so I know all the
Okay.
top 40 songs. And so I'm like on the phone, and my kids and grandkids, how do you know that song? I said, I listen to Ryan Seacrest,
Yeah, that's funny.
American Top 40, and I
Wow.
love it. I love that. I even have classical on my truck. Rap, I love rap music. The only
I
thing
love
I'm
that.
not crazy about, I'm not a country guy, but I like to
I'm,
go
I'm
to
getting into it,
country
man.
concerts. Huh?
I'm getting into the country music. I was actually with my brother here in Boston. He's like, "Don't judge me." He starts to put on some country music, and I'm like, I listen to it from time to time, but I'm like, yeah, this is good. I feel like country music is getting better actually
It,
nowadays.
it, it it really is. It's not like I call the old twang country.
Yeah,
Look,
yeah, yeah.
I've seen Bonnie Raitt. She's amazing. We saw her in Shreveport about 2 months ago. She was amazing. I'd seen her in Jackson about 3 years ago. And I said, we got to see her again. She's 72 years old. She performs nonstop for 2.5 hours. Absolutely phenomenal. And I didn't think I knew her music until I listened to it, and I'm like, I know every one of her songs. It's
Yeah.
crazy.
Um, I love this. I love that, so many times people think of CEO and they just think like very high end, don't talk to this person. But you're very laid back. I can tell that anyone and everyone can come and speak to you, man. And just everything that you told me, the leadership aspect of it, it's because of what you've been able to implement. I'm guessing low turnover as well because of all the
Yeah.
things that you're implementing. Is that correct?
Look, what's absolutely phenomenal. You hear about the national nursing shortage, and it's real. It's a real deal, and it cycles usually about every 20 years. You'll see it, but it really hit during COVID. We lost a significant number of nurses. Some high performers, they wanted to travel, really make crazy money, and they did. Some have come back, but a lot of them didn't. And then we had those folks, I call the baby boomers, that were probably within 5 to 7 years of retiring, said, I'm out. The work was crazy. It was, I hope we never go through another experience like that. But it left these voids. So, we did some things like we partnered with the local university here in town. Northwestern State has probably the strongest nursing program around, and probably 3 or 4 state region. They do phenomenal work. And so we have funded, in order to, and let me step back. When we're talking specifically about an RN, didactical training component, you can put them in a classroom of 500, no big deal. But clinically, it's a 1 to 10 ratio. That's basically nursing regulation. So every faculty member can only have 10 students. So if you do the math, if you don't have enough faculty, then you can't process enough nurses through the system. So we funded, our foundation funded one, and then the hospital itself funded 2 full-time faculty professorships. So, and then we opened up a clinical site here as well. So now we're now in our 4th or 5th year of funding 2 faculty members. That's helped turn out 20 more nurses every 6 months. So they can do their clinical trainings here, and it's made a difference. We have today 0 registered nurse openings in this organization. It's absolutely crazy. Look, but I got to give kudos. My chief nurse is absolutely phenomenal. She is grounded. She's young. She is the strongest nursing leader I've ever worked with in my career, but that has a lot to do with it. And so she's really engaged her leaders to really be connected, and it's made a difference. So to have no RN openings, I cannot tell you.
Kirk, man, a lot of CEOs are going to be jealous of this conversation that we're having because you're just making it seem like it's so easy, and some are still struggling in the same space of trying to get people in the doors. But you're doing phenomenal, clearly. I want to talk about, was Louisiana home for you? Like, how did you end up in Louisiana in such a community that really needed your help, needed your guidance? Is that coming back home? Is this, you just knew you needed to be here?
No, I was born and raised here, South Louisiana guy. I've spent probably 4 or 5 years of my career outside of the state. Probably about 7 years outside of the state. I've never looked for a job. I've always had somebody come knocking. After I had done my international work, I just needed to defog. The bankruptcy work was just, you deal with lawyers and everything else, and I'm like, oh my God, I got to do something else. I want to just do my own thing for a while, and that's what I did. I did international healthcare for about 5 years, and then after that, I was kind of settling down, and I guess you get a reputation, people know about you and hear about you, and so they called and said, hey, look, we got this opportunity. So I am with a large faith-based health system, and their only managed hospital in the entire state is here in Natchitoches. And again, I'm from South Louisiana, and then Natchitoches is in the kind of in the northwest portion of the state. We're about 60 miles south of Shreveport and about 50 miles north of Alexandria, and we're about 26 miles from the Texas state line due west. So it's kind of just a little area with nothing around it. Population, the parish here is about 38,000 total, but we pull from about 200,000 people now into our system. And so no, it just kind of, it afforded itself, and I've never taken a job that was going to be, okay, I'm going to be here 3 years, I'm going to do something else, or I'm going to be here 5 years. Yeah. And look, I've had opportunities within our system to go to other places in the country, and I backed off, and I could have gone and I could have doubled my income, but at the end of the day, I felt like we had unfinished business here. And I still continue to see that today. And so I'm like, I'm not ready yet. I'm not ready to go anywhere. So even my board said, Kirk, you can do anything. You could be anywhere you want to be. And my comment back to them is, I choose to be here. As long as you want to have me, I'm going to be here. And so and it's that philosophy of you work your last day as hard as you work your first day. And at the point when you feel like you can no longer contribute to the job or the community you're working for, it's probably time to do something else. Healthcare is changing so quickly now. We used to do strategic planning. It'd be 3 to 5 years. You do plan out. Now we're planning 6 months out. We don't even plan. I mean, we have long-term goals, don't get me wrong. We've got a $50 million building campaign we're working on right now for this rural community that we're going to launch hopefully within the next 18 months to really transform what I call generational healthcare now. And that'll be my swan song, and I'll step away in about 7 years or so, whatever that looks like. Or heck, I'll hang around as long as they want me. But you've got to just be able to look out the confines of the walls. And I go back to, how do we innovate? When I went to my board and I said, look, we're gonna fund faculty positions. And they first kind of scratched their head. And I said, the end result, we're paying it forward by investing in the education so that we can then develop our own workforce. And why we spend, every time I put a leadership development group through 14 people, that's $100,000 investment. But I'm bringing in coaches, leadership coaches, where we're taking away from the work site and from their jobs, but we're investing in them for the future. And so my challenge to my colleagues and peers is to always be thinking, how do you innovate? What can you do differently today that you weren't doing? Look, healthcare is changing so quickly. You got to figure out how you change. And when you see the changes that are taking place in healthcare as a threat and not as an opportunity, you probably need to do something else because you can't. I mean, look, we got administrations in D.C. change every 4 years and really play a big part in what we're doing. With most hospitals, the vast majority of your income comes from one of the federal programs, whether it's Medicare, Medicaid, or government funding. You got to roll with the administrations. And we've got a new leadership in their group in there now, and they're really pushing back on Medicaid, our most vulnerable population. So we're working on strategies. What do we do to shore that up and not count on federal dollars? You just gotta continue to kind of think through the strategy and strategies and how you manage. And I do very little work now. My team, I got amazing teams, and they do great work. I come up, I walk. Look, I'll tell you, I walk in the office and I'll walk in the mornings, and we have first thing in the morning is a stand-up safety meeting. We bring all the leaders together, 15 minutes. Okay, what's going on? What happened last night? What's not working? Do we have shortage of supplies or medications? What do we need to do about that? So it's a stand-up huddle. We do it on one of our floors, and everybody comes in. We have about 45 people there, and it's done in about 15 minutes. Then I come down, and I do a senior huddle the same way. Okay, what are we doing today? What are we focusing on? But I come back to the group, and I'm like, you guys, you're not going to believe what I thought of last night or this morning. And they know, how long did you stay in the shower? Because I have shower conversations with myself. And so I'm in there, and I'm like, okay, look. So like, take our cancer center, for instance. I'll give you an example of this one. We acquired the cancer center here in town 4 years ago, totally renovated it, totally modernized it, state-of-the-art equipment, recruited some amazing physicians there. And when you finish treatment, you ring the bell. You've probably seen that. You get to ring the bell. Yep. And I thought, let's do something different. Let's put a bell tower outside. So I started looking around for some donors, and I've just met with some folks, some philanthropy people around town. And I went to a family and said, hey, we got this idea. We'd like to build a 3-story bell tower outside the cancer center. So when a survivor finishes treatment, they ring the bell. Well, it took off. Somebody wrote us a check for that bell tower. And it's 3 stories tall. And when they ring it, you hear it. throughout the
Wow.
community, throughout the neighborhoods, and we've tied it into our emergency communication systems. And you hear the bell ringing, and people are like, "What's that?" I said, "Somebody just come." Like they might be in a clinic, they might be in the hospital, and they'll say, "What's that bell ringing?" I said, "Somebody just finished their cancer treatment." It's like when we play the lullaby after when a baby's delivered. You hear the lullaby, and you know, oh, that's some of the good things we do in healthcare where we bring a new birth into the world. It's amazing. So, those are kind of things we do, just kind of, just to kind of tie into folks. So,
Kirk, we need a lot of you throughout the healthcare, okay? I feel like your energy, man, that you bring, I can imagine why people are so excited to even come to work. And that is so important to you, man. Like the energy that you're bringing here, and that this is the energy you bring to your staff, is the reason people want to come back. They want to continue to grow because it all starts from the top. And if this is the energy you're bringing for all the leaders, if this is the energy that you're bringing, believe me, it trickles down this way.
yeah.
So I love that you come with so much energy, that you've cared enough for your own health to make sure that other people can see about their health, right? Like you truly are a leader. You come back to the same community you grew up in, man, to make impacts, right? You didn't have to. It wasn't to you. We mentioned a little bit earlier. It wasn't about the paychecks. It was about the purpose and the passion of leaving something back home where it all started for me. And just kudos, Kirk, man. I love that you shared the message because that was really my last question, is that message for those leaders, and you shared that. So I kind of go right into that blind question, man, as we start to wrap up. You spent your life building for others, but what's one decision you waited too long to make, and what did it teach you about leadership that no book could ever teach?
Let me think through that. I've always been, I think the biggest thing I learned from a leader a number of years ago, and I thought I was doing a great job. I thought I was a cat's meow. I'm like, oh, that's my first true leadership position. And so my boss she calls me in, she goes, "Hey, how do you think you're doing?" I said, "I think I'm doing great." And she goes, "Well, let me tell you where you have some opportunities." And she says, you're a little disorganized, you're kind of scattered out there. And so this is what I want you to do. Every morning we're going to do a 5-minute check-in. So where my stand-up meetings kind of come from? Came from a leader. And so she said, "Okay, I want you to write. I want you to come to your list and talk about what are the things you're going to be working on today. And then end of the day, let's meet and talk about the things that you accomplished." We did that for only maybe 2 weeks, and after that, totally changed my thinking on prioritization, and the ability to make change, and how to be organized. And so I am meticulously organized today. I walk around with a calendar in my hand, and I'll show you. It's just my calendar's like this, and you see writing on there.
Yep.
I write notes as I'm rounding, and you see some are scratched off, and they're stacked up on my desk. And if I ran into you in the hall and you said, "Hey, this is what's going on, we're having a problem with this," I'd write it down. And then I'm going to follow back up, and when we close the loop, we fix it, I take it off the list. And I've done that with our leaders, and we set times on everything. But when I really look at, when I talk about leadership, probably the biggest thing for me was, if I had to do anything over again, earlier in my career, I would have exhibited greater leadership courage. You've got to be willing to be okay to stand out there in front by yourself. Yeah. And you're always about a team. It always is about a team. But I believe it takes that leader to have that courage up front to be able to do things. When COVID hit, look, I will tell you, I can remember we had just invested heavily. I recruited a number of subspecialists, and to the tune of like $4 million in additional salaries alone for 5, 6, 7 doctors. Mm-hmm. And I'm like, then everything came to an end. No more elective surgeries, no more elective cases. I'm like, that's 80% of business in healthcare is elective, is outpatient. So we quickly had to turn around and stand up Zoom meetings, Zoom, visits. But I was I would go home in the evenings, and I was working probably 18-hour days then. I'd go home and I'm thinking, I've got 800 families. How are we going to feed them? What are we going to do about them? And so I said, we're just going to lead this change. And we got to get out front, and we got to figure out, get in front of the communities and get in front of legislators, figure out ways what we need to do. Don't wait to be told, lead, be up front. And that totally, what I learned a handful of years earlier in my career, I've taken with me. And it's about having that courage to get in front and being comfortable enough to be able to say, this is why we're doing it. You may not agree with it, but just come along with us, and hopefully you'll see, because change often is insidious. When you look back on things, you can look back and say, now I understand it. So come along with us. So again, I think always having purpose in everything you do, and using leadership, and having leadership courage to be able to get out there and get in front.
Well, Kirk, man, I really appreciate the time here. We could do this for a long time. I can imagine there's so much more gems that you could really share with us, but I really appreciate the conversation. Very transparent, very real, but also just showcasing why you are in the space you're in today. And hope that a lot of leaders can kind of take from this as well and continue to implement those things in their organizations, because you're doing phenomenal. Can imagine what's happening in the next 5-10 years with everything that you're mentioning. New building is happening because of you. So we definitely thank you. For those that are watching, continue to share, like, subscribe. This is how we get those messages out. For those that want to be in the healthcare, we need real conversations with real leaders talking about what's really happening. And Kirk, you did that for us today, so we appreciate you. I'm Efrain. This is Kirk. We'll see you on the next one.
Great. Thank you.